Have you heard the news? There has been a new FDA-approved drug to treat dog lymphoma, and it comes in the pill form. It's called Laverdia. And in this vlog, I'm going to tell you the good and the bad and everything you need to know about it. So let's jump in. Let's talk about Laverdia for dog lymphoma. So Laverdia was FDA approved for dog lymphoma in January of 2021. And I'll be honest, I waited a couple of months to gather some information before I did this vlog because I really wanted to make sure that I was presenting and getting all my facts. So there's been some publications and there's actually recently been some webinars. So it is a new class of drugs. It's something called a Sine Inhibitor. But I think before we talk about some of the data for Laverdia, that is the trade name, it's also called verdinexor. I think it's really important to take a step back and just kind of talk about lymphoma in dogs. So I want to do that first. There is really such a huge unmet need when it comes to treating lymphoma in dogs. It's definitely one of the most common cancers that I treat in practice. They're coming to me and we end up treating them with the CHOP multi-agent chemotherapy protocol, which is an expensive chemotherapy protocol that requires intravenous chemotherapy. And there's a lot of safety precautions that go into that. Personal protective equipment, a chemotherapy hood, which we make up the chemotherapy in. But lymphoma is the most common cancer, and it's also a very expensive cancer for the majority of people to treat. And when you look at the numbers, and we're going to talk about that, it's estimated about 80% of people who have dogs that are diagnosed with lymphoma don't end up treating their dogs. And there's lots of reasons for that. It's not a very simple reason, but one of the reasons is definitely cost and the fear of chemotherapy side effects. And I've spent a lot of times, a lot of what I do and why I started to do social media is to break down the myths and misconceptions. Because even that CHOP multi-agent chemotherapy protocol, most dogs, it's very well tolerated. Chemotherapy side effects, even when we give a big chemotherapy protocol, their side effects usually are minimal. We're very proactive with our nausea medications, our diarrhea medications, our appetite stimulants. But again, when you talk to people and we do surveys about why they don't treat, it's often cost, fear of chemotherapy side effects. It's, the schedule when we do a CHOP multi-agent chemotherapy, it's often weekly trips to see an oncologist. And often it's really difficult to get in to see an oncologist. Currently, right now, it can be weeks to often months to get into an oncologist. And so a lot of people would rather stay with their general practitioner. And so again, there's just a huge unmet need when it comes to treating lymphoma. And I think that's where Laverdia might fit in. So I am more excited about Laverdia now that I'm starting to think about where it might fit in with this unmet need for dogs with lymphoma. It's also estimated that about 2,000 dogs per day in the United States will be diagnosed with lymphoma. The statistics are staggering. And also that in 2021, there will be over 750,000 dogs diagnosed with lymphoma. When you look at some of the statistics of the treated and the untreated dogs, about 150,000 dogs, their owners will elect for treatment. And those are usually the ones that see people like me, right? That are going to end up seeing the medical oncologist, the board certified cancer specialist. And then, there's about 550,000 dogs. So it's estimated 80% of those dogs are not treated. And again, we've talked about, the number of reasons. For the dogs that see me, again, based on some recent studies, estimates a little more, about half of them will go onto a CHOP multi-agent chemotherapy. So they're cycling through different chemos. And again, I talk about the different chemotherapy options in much more detail in another 2-part series. And then there's often single agent protocols, which are often elected, which are a little less expensive. And instead of going in weekly, you might go in every 3 weeks. We have the new Tenovia option and things like that. But, depending on what part of the country you're in, a CHOP multi-agent chemotherapy protocol, it's going to be more expensive for a bigger dog because they're getting more chemo, but it can be $5,000 to $7,000 to even $10,000 for that initial protocol. Those every 3-week protocols are usually half that. So again, it can be very cost prohibitive, especially if you don't have pet insurance. So again, this is why I think when I'm thinking about the good and the bad of Laverdia, I think, some of these factors really make Laverdia a more enticing option. And so now we're going to dive in and jump in and talk about Laverdia. So I mentioned that it's something called a Sine Inhibitor. It's a different mechanism of action. I really want to kind of simplify it. And I think what I want you to know is that this is going to be the first of many vlogs to come out about Laverdia. We are at the cusp of learning about it and how it will fit into the lymphoma treatment protocols, because we just have, some initial studies based on it. So, and it's also conditionally approved at this point, which means it has been shown to have reasonable safety and efficacy. And then the company Anaviv has 5 additional years to continue to show efficacy, and then hopefully will be fully approved. And that's the same thing for Tenovia, which is another lymphoma drug. Sometimes drugs don't make it from conditional approval to full approval. What does that mean for you as a dog owner, as a veterinary professional? If something is conditionally approved, we can only use it for what it's labeled for. So we're only going to be using Laverdia for dog lymphoma. We're not going to be using it for cat lymphoma. We're not going to be using it for other cancers until it's fully approved and studies have been done for that. So what are the pros of Laverdia? One of the biggest pros is that it's oral chemotherapy. So it's something that you're going to be giving at home, and it's given twice a week. So that's super simple. You don't need to go to a medical oncologist. It's something that you can be getting from your general practitioner. So that makes it easy to give. It makes it very convenient. It's also much less expensive than the other chemotherapy protocols. So again, that is another advantage, and I'm really excited about that as well. So the cost will again depend on the size of your dog, because bigger dogs get more chemotherapy. But as of now, in the summer of 2021, it looks like the price will be around, I think, $250 to maybe $600 per month, depending on the size of your dog, depending on the part of the country that you're in, and things like that. So again, much more reasonably priced than some of these injectable chemotherapy protocols. So that's some of the good things about Laverdia. The other really important good thing is that it's well tolerated in the initial study. So the initial study had just under 60 dogs, and the quality of life didn't decrease. The dogs really tolerated it very well. So in general, when we think about chemotherapy, I think about 3 main categories of side effects. Most of the time, dogs don't lose their hair. They don't on this. And some chemotherapies, they can get low white blood cell counts. Really didn't see that in the initial studies. And then the other main category is GI, gastrointestinal. So vomiting, diarrhea, and changes in appetite. So a possible side effect of Laverdia is anorexia or decreased appetite. In the study, it was usually mild to moderate, and was usually alleviated with low-dose steroids. In the study, at this point, you could also use things like Entice or other appetite stimulants, Serenia, and things like that. In the initial study, they used steroids, which does also treat lymphoma. So it makes interpreting some parts of the study a little bit confusing, just in terms of the response of the drug, or did they respond to prednisone, because they did use steroids to improve their appetite if they had appetite side effects. But again, overall, it was a very well tolerated drug. And your clinician, they can increase the dose a little if they're tolerating it and they're not going into a complete response. And if they're having side effects, you can lower the dose as well. So take home message, it's oral, it's convenient, it's given 2 times a week, and it's pretty reasonably priced compared to other chemotherapy protocols. All right, but what's the bad of Laverdia, Dr. Sue? The bad is it doesn't replace CHOP multi-agent chemotherapy. It doesn't have the high complete response rates that we get with a multi-agent chemotherapy protocol, unfortunately. You're not going to get the same long-term survival times that we see with a multi-agent chemotherapy. And I talk about that in the other vlogs, but with a CHOP multi-agent chemotherapy, we get 90 to 95% complete response rates, median survival times of about 13 to 14 months. About 25% of the dogs are alive at 2 years. And just to remind everybody, for lymphoma, without treatment, unfortunately, the survival times are horribly short, about a month, and with steroids, about 2 months. So, it's a devastating disease, and I really go through that in the other vlogs, which I'm going to put links to below. So it's not a replacement for the CHOP multi-agent chemotherapy. It's not the standard of care, but it is an alternative option for a family that maybe doesn't want to do multi-agent chemotherapy, doesn't want to do an every 3-week protocol, which would still be my second best protocol. What they did see in this initial study is the overall response rate was just under 40%. Again, it was a small number of studies. They were really showing safety and efficacy as well. What we know about these Sine inhibitors is that often they'll be used with other drugs. This was an initial study where they're using it alone. So that's why I say this is not the only vlog that you're going to be watching about Laverdia. We need to wait for more studies to come out. Perhaps if we combine it with other drugs based on, future studies, we'll see improved responses. But there is a subset of dogs where you can see sustained responses, stable disease. I always tell people it is so important for dogs with lymphoma to get into a complete remission. And if they're not in a complete remission, we change protocols. This may change the way we think about some dogs with lymphoma and that stable disease with, a good quality of life. 3 to 6 months may be good, and it may be something to consider. So it also could be something we can use when they relapse after their CHOP protocol, after their other protocols. So I think there's a lot of uses. Again, it could be used as a first-line protocol if chemotherapy is declined. It may be used as a rescue or relapse protocol after other protocols don't work. And again, it may in the future be used combined with other drugs, and maybe we won't see the developing resistance to the chemotherapy. So lots to learn about Laverdia. I am really excited about it. It's something to talk to your general practitioner, talk to your cancer specialist about. Stay tuned. I promise to provide more information as we learn about it, but I felt it was time to hop on here and tell you some of the good and some of the bad and tell you just to stay tuned. I know there's more questions. I have lots more questions, but I felt it was time to at least talk to you about it. I hope it was helpful. I know you're going to give me some questions, give me some comments. I hope this was helpful. I look forward to seeing you at the next vlog. Thanks so much for joining. Stay well.